Dr. Keith here, the Bone Doc. Today's hot, helpful orthopedic topic, arthritis. Let's talk about arthritis. What is it? What causes it? How do you get it? How do you get rid of it? Well, there are multiple types of arthritis, but today we're going to focus on the common wear and tear arthritis that is referred to as osteoarthritis. This is in contrast to immune-caused arthritis such as rheumatoid arthritis or lupus. It's also a bit distinct from post-traumatic arthritis that can happen after a major injury. This is typically the wear and tear arthritis that we usually attribute to older people, although it can happen at younger and younger ages and seems to happen at younger and younger ages these days. First of all, to understand arthritis, you have to understand the term arthritis is just inflammation of the joint. So arthritis, arth meaning joint, itis meaning inflammation, can happen at any age. But what we typically are talking about when we refer to arthritis is not just inflammation, but actually the degeneration of the cartilage surface of a major joint or a minor joint that ultimately causes pain. So I usually tell my patients that cartilage is the perfect structure to cover the joints. It's extremely smooth. Its coefficient of friction is extremely low, even smoother than ice, and more importantly, it nourishes itself with the synovial fluid that it bathes in. As well, cartilage has no nerve endings, which makes it a perfect surface to cover the ends of the bones. So I joke with my patients that you could hit cartilage with a hammer and you won't feel it because there's no nerve endings. But just underneath the cartilage in the subchondral bone, there are millions of nerve endings that are just waiting to give you pain. Very similar to your teeth, where you have enamel that covers the tooth, but underneath you have the nerve root that causes pain. So when the articular surface or the cartilage surface breaks down and degenerates over time, the underlying subchondral bone and the nerve endings that reside within that bone cause pain. Now we're talking about type 1 cartilage, which is the smooth, hard cartilage that coats the ends of the bones, just like dipping an ice cream cone in chocolate. If you get that smooth coating of chocolate on top of that ice cream cone, that's sort of the smooth coating of bone, or the smooth coating of cartilage that coats the ends of bones. But when that cartilage starts to crack and break down and degenerate over time, it can allow the subchondral bone to transmit pain. The body does a lot of different compensatory mechanisms to make up for this, and that's where bone spurs and hypertrophic enlargement of bone happens in response to the stresses that the joint sees and the bone sees. As the cartilage breaks down, the body tries to build up a protective coating of extra bone that on x-rays is seen as osteophytes or arthritic enlargement and what we call Fairbanks changes to the knee in this instance, causing a squaring off of the knee, where the knee starts to look like a picture frame and it gets large and enlarged and square shaped as opposed to the conical, smooth, conical, slender shape that most knees typically have without arthritis. So how do you treat it? How do you get rid of it? Well, unfortunately, we don't have a cure for arthritis, and we don't yet have the technology to stimulate your cartilage to completely reform. Our toolbox for treating arthritis, unfortunately, is somewhat limited, and it can include such non-surgical treatments as physical therapy, bracing, anti-inflammatory medications, intra-articular injections of everything from cortisone to hyaluronic acid to stem cell injections, and ultimately, when all else fails, is surgical arthroplasty. There are different types of arthroplasties. There's partial knee arthroplasties, total knee arthroplasties, different brands, different models, different types. But in general, a primary knee arthroplasty is essentially a resurfacing of the worn out surfaces of the knee. So, for example, when I mention the word knee replacement or total knee arthroplasty, most patients think that I'm referring to just removing the entire knee, removing the knee in its entirety, and putting a bionic knee in its place. Well, in actuality, a knee arthroplasty is much more similar to a resurfacing procedure than truly a complete knee replacement. Usually we only take about 2 millimeters of bone off one side and about 9 to 10 millimeters off the other side, so just a little bit thicker than an orange peel is the amount of bone that we remove. And in its place, we replace it with metal and plastic, which take the place of the worn subchondral bone that is removed, as well as the worn cartilage that is no longer there. The result is a smooth, although not as smooth as your native cartilage, but a smooth, pain-free surface articulating surface for your knee to use in order to bend, to stand, to walk, and to do essentially normal activities. The recovery time varies from individual to individual, but in most instances, patients will recover walking within the first afternoon of surgery, will begin to take steps and begin to bend the knee, and each subsequent day with physical therapy will improve range of motion, function, confidence, balance, to achieve the maximum range of motion and strength and stamina that the knee can achieve. So, there you have it, today's helpful orthopedic topic.